Do you want to return to fertility quickly after stopping it? So if you want to get pregnant quickly or immediately after stopping it, the barrier method or the IUD might be a better option. And if you want a permanent method of contraceptive, then vasectomy and sterilization will be a better option. Choosing the right family planning method is a very important decision that affects both your health and your future. With so many different options available, from short-term methods such as your injections and pills to long-term methods such as your IUD and implant, it is very difficult to actually make the decision on which family planning method to choose. So on this particular video, I'm going to be sharing with you key factors, key things that you should take note of when choosing a family planning method, from your lifestyle, your health status, and also your personal preferences. Good day everyone, and welcome back to Nurses Lecture Room. My name is Mercy Mary, popularly known as the Nurse with a Difference. And on this particular video, I'm going to be talking about 7 key factors you should take into consideration when picking a family planning method. So the first one I'll have to share with you is your health status. Remember, health is wealth. Health is wealth. Some contraceptives are not ideal for everyone. Some contraceptives are not ideal for everyone. Women who have high blood pressure, migraines with aura, blood clotting disorders are not advised to use family planning method containing estrogens. They are not advised to use family planning method containing estrogens, such as your combined oral contraceptive or your patch. And also, women who are above 35 and are smoking, they are not advised to use family planning method containing estrogen. Why? Because they put themselves at risk for cardiovascular diseases such as stroke, yes, and heart attack. So if you are above 35 and you are smoking, you are a woman with high blood pressure, migraine with aura, clotting disorder, family planning method containing estrogen is not advised. So the doctors are likely going to tell you to go for the progestin only pills and IUD. The second key factor you have to put into consideration is your lifestyle and convenience. You have to consider how much attention and how much time you are ready to give into it. So if you are someone that travels a lot and you don't have that time to be visiting the hospital monthly or quarterly, long-term method might do justice. Long-term methods such as IUD and implants might be preferable. If you don't have that time to be taking pills every day, you are forgetful, you feel it's not something you can meet up to, the long-term method or the quarterly or monthly visit might be something you should take into consideration. And if you are someone that likes spontaneous things and you like flexibility, you like changing styles and things, you can decide to go for condom. So you have to consider your lifestyle, you have to consider your convenience, you have to think about yourself. Which one is more comfortable for me to use? Do I want to go to the hospital monthly? Do I want to go to the hospital quarterly? Am I going to enjoy taking the pills daily? So this is something you have to take into consideration. The third key things that you have to take note of when you want to pick a family planning method is your future pregnancy plan. Do you want to return to fertility quickly after stopping it? Do you want to get pregnant immediately after stopping it? This is something you should take note of. So if you want to get pregnant quickly or immediately after stopping it, the barrier method or the IUD might be a better option. And if you want to get pregnant months after or a year after, you can consider taking the injectables, because for the injectable it might take months, a month, 2 months, or even a year to return to fertility after stopping it. And if you want a permanent method of contraceptive, you don't want to get pregnant, then vasectomy and sterilization will be a better option. Then the fourth thing you should put into consideration is how effective is this family planning method. It's not just to choose the family planning method, it's for you to understand the effectiveness of the family planning method. So in another video, I'm going to be explaining the effectiveness of each family planning method. So I will advise you to stay tuned and watch out for that particular video. So the fifth thing that you have to take into consideration is the side effect of this family planning method. In reality, all family planning methods have their side effects, but what matters is how much it affects you. So hormonal method may cause changes in your period. It may also cause mood swing. Then the other method, which is copper IUD, may cause heavier period and cramps in the first few months. And for condoms, it might reduce sensitivity for some people. So you have to consider which side effects of this particular family planning method you are ready to deal with or you are comfortable with. On another video, I'm going to be talking about each method of contraceptive and also their side effects. So we're going to be dealing one contraceptive at a time, explaining in details their side effects, how they function, and what to do. Then the sixth key thing you need to take into consideration is your partner's involvement and shared responsibility. Yes, when it comes to family planning method, I see a lot of people saying that it ought to be the woman's responsibility to think about how to prevent pregnancy. But in all, it's a two-way thing. Both parties are involved, the man and the woman. So it now depends on what they want. It's a shared responsibility. The man might decide to take the family planning upon himself to do vasectomy, or the woman might decide to take the family planning upon herself and take pills, injectables, or sterilization method of family planning. So it all depends on both parties, and that is why communication is very important. So if you are talking about sex together, it is very important for you to talk about family planning method together. So responsibility of the partner, shared responsibility is something you should take into consideration. Then the seventh key factor I would like you to take into consideration is how do you use it? Do you want something that you want to easily do by yourself, pills you can easily take by yourself, condoms you can easily use by yourself, or you want to always see the doctor? You know, some people are not really comfortable with visiting the doctor regularly. They prefer to do things on their own. So if you are someone that would like to be doing your own family planning method by your own self, then you can consider pills and other things. But if you want the doctor's involvement, then you can consider the other methods such as your implants, your injectables, and things like that. So you have to consider what is convenient for you. If you want to be seeing the doctor, if you want to visit the doctor regularly, or you want to actually do things yourself, you don't really want to see their faces. You don't want to see our faces as nurses and doctors. So it's actually a personal decision for you. So these are the key factors I want you to take into consideration when choosing a family planning method. And one thing that is very important is your health status. So if you have a blood pressure, if you have blood clotting disorder, if you have migraines with aura, that is something you should discuss with your doctor. That's something you should discuss with your GP before picking a family planning method. Just go to the roadside pharmacy to get family planning and start using it without proper history taking. Proper history taking is very important when it comes to family planning method. And I want you to know that people react differently to family planning method. There are some people that have said that they've ended up adding extra kgs as a result of the family planning method they use. There are some people that say that they experience heavy cramping, heavy bleeding as a result of the family planning method they use. Why some people experience little or nothing at all when they use the family planning method. So if you are having a family planning method and you are experiencing something unusual, what I advise you to do is to consult your doctor, is to speak to your doctor about it and get useful help and guidance. So this is all I have to share with you today, and I hope it is beneficial. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye, and see you in our next video.